All right, good afternoon, everyone. Thank you so much for joining us on this latest installment of live updates on COVID-19, our Facebook town hall. I'm Katie Crystal, a member of the county board. I will be your host today, along with my colleague, Matt DeFerranti, fellow county board member. We also have Jim Schwartz, who's our deputy county manager, representing the county's executive leadership team. And we have some special guests focused on public safety today joining us. Fire Chief Dave Pavlitz, Police Chief Jay Farr, Lissa Friedman, who's the Bureau Chief for Child and Family Services, and Candace Lopez, who's our lead on Project Peace, our community response to domestic violence and sexual violence. So welcome. We're looking forward to taking your questions. Before we jump in, we have a few highlights to share with some data about the week and upcoming information about COVID-19 in our community. So Matt, I'll turn it over to you.
Sure. Thank you, Katie. And thanks everyone for joining us. For Arlington, our fight against COVID-19 continues, and there remain challenging days and evenings as the number of new cases continues to increase in the National Capital Region. As of right now, we have 1,004 cases, confirmed cases in Arlington, and we've had 42 individuals pass away. The region as a whole, that's DC, suburban Maryland, and suburban Virginia, has seen 24,445 cases and just over 1,000 deaths at 1,026. So this confirms we know the disease is present and it is spread. We should assume that is throughout our county as well as throughout the community. This week we took some steps. We launched a new dashboard, a COVID-19 dashboard, on a refreshed website, a website page, which is a tool that provides the number of cases and fatalities in real time. We want you to know and to have the most accurate and available information at your fingertips as our county's current numbers and where we stand in comparison to the region as a whole. The data on the dashboard is sourced from the Virginia Department of Health, and it is updated at a couple of different points throughout the day. We're also scaling up quickly our testing capacity. We have 2 sites, and we have the opportunity for testing at 2 sites as well as at Virginia Hospital Center. So we're continuing to work on that. We've had a slight uptick here in Arlington, but it's not increasing at the rate that you see at many areas across the country of the same size. We still need to take those key steps. We encourage all Arlingtonians to wear cloth face coverings when you're in the public settings, when you're at risk, and when you're in doubt about whether you're at risk. And then we also want people to be vigilant about those social distancing measures that are the key to flattening and eventually closing and crushing the curve. There's the settings that you should be concerned about are grocery stores, pharmacies, work settings for those who are essential employees, if you are volunteering, or if you're seeking medical attention or caring for your family. You should always think about those social distancing steps as well as washing your hands. This is not meant as a replacement for staying at home. Hand washing and staying 6 feet distance from people is always best practice. And they're the cornerstones in the effort to slow the spread of the coronavirus. We also have been working this week and steadily throughout this crisis on food and housing assistance, which are so important as we work to weather this whole last 6-8 weeks and the ongoing work that we're doing. We reached out to over 200 property managers this week in multifamily buildings to share information with renters this week. We're sharing resources about food and domestic violence hotlines, as well as steps to protect yourselves and your families. The importance of social distancing and face coverings and hand washing were also part of that information we shared with renters in multi-unit buildings. So that's big picture. I'll turn it back over to Katie, who's going to talk a little bit about the governor's announcement this past week and what it would take to reopen, which you may remember was the subject of some of last week's Facebook and live town hall.
Thanks, Matt. There's definitely been a lot of attention given to that announcement about the criteria for reopening. The governor was really clear. Any reopening has to be data-driven, not date-driven. So some of the things that we're all looking for is a sign that it might be safe to begin reopening or loosening some of those social distancing and stay-home provisions are a downward trend in the percentage of positive tests over 14 days, a downward trend in hospitalizations over 14 days, increased testing and tracing, enough hospital beds and intensive care capacity, and an increasing and sustainable supply of PPE. We are continuing to work with our National Capital Region partners here in Arlington to ensure coordination, and we are also continuing to work as Arlington County, along with our regional state partners, on hastening those latter categories, the PPE supply chain, increased testing and tracing, and ensuring hospital capacity. But in the meantime, and that brings us to today's focus of conversation, we are still in the middle of response to the pandemic. We have several special guests, as I mentioned, here to talk specifically about public safety in our community during this time. We're going to encourage those who are watching, submit questions through the chat box on Facebook. I'm tracking that, or via text at 571-348-3053. Matt is tracking that, and we will alternate with your questions. We're taking questions on any COVID-19 related topic. We're going to begin with public safety, but please feel free to ask others. Okay, so let me begin with Chief Farr to talk a little bit about enforcement. This is a major question in our community about the governor's stay-home order in particular. What role do we have in enforcing that stay-home order, and particularly enforcing the prohibition on gatherings of 10 or more people in Arlington?
So, well, one, good afternoon. It's a pleasure to be here. I think the most important thing to sort of take away is, even in the best of times when we are normally operating without this whole pandemic, the police department's always incredibly dependent upon compliance from our community for us to be successful. Right now, we probably need that more than we've ever needed it. The executive order that the governor put out has been pretty clear. When it's a stay-at-home order, that's the message that we need to take away. It is a stay-at-home unless you have some other specific reason to go out. As Mr. DeFerranti mentioned, there are a number of things, whether it's going out for groceries, it's going out for medical care, whatever that might be. Predominantly, what we're asking for people to do is to be in compliance and follow those rules. Where we've had some challenges to date have really been focused around the parks or out in the public areas with the weather changing, getting nicer, and I'm sure with people just trying to get out. The social distancing rules become a little bit harder to deal with. You'll know that we sometimes get calls to go out and respond to different things around the community. Generally, it's because someone has called us and asked about community gatherings. Our mission to date has really been to see compliance. So if we go somewhere and there's people and they're crowded up, we're not out there to see about writing summons or to enforce the order. However, we see compliance, and I'm happy to say, Ms. Crystal, that the vast majority of the time, that's what we get. We've had some calls to residential homes, but they've been very few. The majority of it's really been around the parks and open areas of that nature. And we have had a few challenges with some of the businesses in the county where we have had to go out more than one time. And when we do go to a business, we provide them with a copy of the governor's order. We explain to them exactly what the requirements are. And it usually starts off with a verbal warning and maybe a written warning. And so far, and knock on wood, so far, we've not had to issue any actual citations. But ultimately, I guess the heavy stick in this is a Class 1 misdemeanor to violate the governor's order. And we try at every cost to avoid that. So overall, compliance has generally been pretty good. I think our challenge will continue to be in the parks, but as long as we maintain some level of social distancing, we should be in good shape.
Thank you so much. And sort of a similar question for the fire department, Chief Pavlitz, what are you all seeing, particularly emergency medical services, with regard to responding to COVID-19?
Thank you very much. Good question. We've seen a reduction in overall call volumes by about 25%, but we are definitely seeing and transporting and treating some very sick patients. So I'll kind of take everyone through a typical 911 call. So if someone's feeling bad or someone needs to call for emergency services, you'll be connected to an emergency communication center operator, ask a standard series of questions. If there's any COVID symptoms or if someone is COVID positive, if there's not an extreme distress, if someone needs emergency care, we're dispatching units immediately. But if someone is just have some symptoms or some questions, we're going to kick them over to a medical triage line to ask another series of questions. From there, we may dispatch a non-emergency or non-transport unit just to do a quick assessment and to possibly provide treatment in place or self-care. Now, if someone is sick, if someone does need critical care, we're immediately responding, we're immediately assessing, but we may look a little different. We'll probably have much greater personal protective equipment for our protection and also the patients. And we'll be asking sometimes to step out of the house or step out of a group setting and possibly putting a mask on those patients. We're going to get them quickly into the hospital. So we're seeing less volume of calls, but we're spending a lot more time on those calls to make sure we're protected. We're doing heavy decontamination and cleaning of our medic units and also within the fire stations. So the focus is to protect us, to protect the public, and to also protect our families. So we routinely do a series of medical screenings at the start of the shift, in the middle of the shift, at the end of the shift, to make sure we don't have high fevers, we don't have all the symptoms associated with COVID-19, just to make sure we feel confident that we can help the public and also protect our families at home.
Which is really the most important thing, and we're grateful to members, particularly of our fire department and police department, who are out not only putting themselves at risk, but concerned about their families. It's good to hear everything that you all are doing as departments to prevent that risk. We know that a lot of our community needs haven't stopped just because of the shutdown or the COVID-19 pandemic. And I wonder, Chief Park, could you talk a little bit about the police response to community needs and whether any of that has changed, those ongoing calls for service?
Well, I'll start with the calls for service. So the calls for service and how we go out and do that really has changed a bit. The real difference, and the primary difference, is that for all of our non-critical calls, so if you think about a late report, a late theft, a late larceny, or something that's not an in-progress call, or something that's a crime against property specifically, we have pretty much asked the community to do the online reporting. And this is a pretty significant change because for many years, people expect you call the police officer is going to show up at your door. To this end, our calls for online reporting are up to, I think they're up almost 50% right now. And they're really the bulk of our calls that come in. Our overall calls for service in the general realm, like the fire department, have gone down. We are responding to fewer calls, but of the things that do come in, the online reporting has really helped us. To be consistent with some of the others, though, when we do dispatch a unit, so let's say it's a late assault or it's a more serious crime that we're going to have contact, it's not uncommon for the officers to go out and ask people to step out of their home, maintain that social distancing. If we are going to have any close proximity to them, our officers are either provided with the N95 mask or other masks. And so the overall how we engage with people has changed quite a bit. We still have that one-on-one on the more serious things, but the engagements change. In the broader sense of the community, it's been sort of challenging. We have a community engagement team, and that's their primary focus is to go out and do these community service meetings and others. We've been able to maintain some of those. We've been invited to some of the Zoom related meetings that the civic associations are having, and so we still do some outreach there. But in lieu of doing that, our officers, our school resource officers and our community outreach team have really divested a lot of their time now into working with the libraries, with Diane and with the food distribution networks, and basically trying to support some of the other community efforts. And they've also spent a fair amount of our time on some of the testing sites. So we're still out there. It's just in a little bit different way, and we are still participating. As a matter of fact, I'm on the CPRO annual meeting on Saturday. I guess I'll be from home, so it'll be a little bit different.
Excellent, and thank you for doing that. I think you also forgive the background noise in my home. I think you can hear some of Arlington's finest out there breaking up potentially a traffic accident or something else. So there's another aspect of public safety, and this is something we've been really attuned to and concerned about in our community, which is domestic violence and child abuse, knowing that the likelihood for instances of those forms of violence could be increasing with the pressure on families right now, the stay-home orders, and other strains. So I'm really glad that we're being joined by first Candace Lopez, who's our coordinator of Project Peace, which again is that interagency community response to domestic violence. And I wonder, Candace, could you tell us a little bit about how those services have been impacted or needs that you're seeing by the coronavirus?
Sure. Thank you for having us today and for letting us talk on this very important topic. Domestic and sexual violence services are considered essential services. So while the way we might be providing those services looks a little different today, the same services are still available to the community, to anybody who needs them. In particular, there are some services that are available 24/7, since a lot of folks might need access to emergency and crisis services at any time. So for example, our Arlington 24-hour domestic and sexual violence hotline is available to anybody who needs it around the clock, as well as Safe House Shelter and access to forensic exams through the FACT department at Inova Hospital. To access any of those 24-hour services, including access to protective orders, you want to call our 24-hour hotline at 703-237-0881. In addition to those crisis services, we still have some non-crisis services available as well, whether it is counseling through telehealth and video chat support, or it's, again, access to support at the court to obtain a protective or restraining order. Those services are still available by our partners at Doorways, as well as Legal Services of Northern Virginia. We are seeing that, specifically to our community partners, to the Doorways hotline, that they continue to get calls for services and requests for support, but those calls have declined a little bit in the wake of COVID-19. We are anticipating that those increases for need for service will go up as isolation winds down and as the stay-at-home order stops, because we are concerned that folks just don't have access to calling the hotline or to get those support services. We don't think it means that there was a lull in domestic violence or that domestic violence has stopped. We're just concerned that people aren't able to access. So knowing the hotline, knowing that those services are still available, will hopefully help anybody who's listening today. If you yourself feel like you're unsafe at home, or you know a friend, family member, or colleague who might be unsafe at home.
Thank you so much, Candace. It's incredibly important work, as is our Child Protective Services. Oh, as is our response to child abuse in our community. And so I'm glad that we're joined by Lissa Freeman, who's our Bureau Chief for Child and Family Protective Services. And Lissa, could you speak a little bit about how Child Protective Services is responding to reports of child abuse and neglect during the pandemic, and what community members should know and how they can help?
Sure. Thank you. Good afternoon, and I appreciate this opportunity also to speak to the community. Well, Child Protective Services continues to respond to ensure child safety in the community, and we have our investigators prepared with personal protective equipment to respond in person if they need to. As you're hearing from fire department and from Candace about domestic violence, our call volume is also less. We attribute that to the fact that the schools are closed, and with a family staying at home, there's less eyes on, so to speak, of the children that need support. We depend on our community members to help keep our children safe, and with families staying at home, we have less of that opportunity. But what we do know is that when families are under stress, then the opportunity for, or the chance of child abuse and neglect occurring is going to rise. So as Candace was mentioning, we're concerned about what child welfare colleagues have started to call a surge of reporting. And so we're starting to think about that and prepare. But in the meantime, we want to reach out to families to try and help them manage the stress so that we can reduce the possibilities of abuse and neglect. So Child and Family Services has always been the goal has always been to strengthen and protect children at the same time so that families can stay together and children can stay safe at home. So we do a lot of parent education. Right now, Child and Family Services is offering virtual parent education outreach, and CPS is doing a specific class on safe supervision, safe discipline, and safe sleep. And residents can access information about those classes from our website. We're also working with our Child Safety Net members, our collaborators, our law enforcement, domestic violence partners, and mental health therapists in schools to reinforce what resources are available in the community so that our community members know, yes, we're still here. We want to help. There are resources available. Please call us, because Child Protective Services continues to be available 24/7, 7 days a week. And what we're asking community residents to do is to call us at our hotline, which is 228-1500 if you have any concerns about children in the community. Every call doesn't mean that we respond and that children have to be removed from their homes. Most of our calls are for support and for resource connection, and we want to hear from our community members. If you have any concerns, we will help you talk through what the proper response would be. So continue to know we're here and ready to help.
Thank you so much, Lisa. And I think that's a really important message for everyone in our community who supports and cares about kids in their lives. So we have lots of questions coming in fast and furious. Matt, why don't we start with you? Because I know we've got a lot of questions coming in from the phones, and then I'll try to pose a few that we're seeing on the Facebook chat.
Sure. So there are a lot of questions, and there are two related questions that I'll. One regarding for the chief, police chief Jay, Chief Farr. One is regarding personal protective equipment, and the other is regarding fraud. And just give me a second. There's another bucket. I wanted to tee those up, and there's one other bucket of questions that has been asked. And then I'll kick it over to you. So there's some questions that have been asked about. There's a couple in Ballston in their 70s who wants to stay safe and is concerned about how they can do that. There's an individual who wrote in about making sure people who work at grocery stores are wearing masks. Both those questions related to masks, and the answers to those questions that I'll just start with, and if you have anything to add, feel free, Katie or others, but really washing your hands, not going outside, ordering groceries if you're able to schedule them in advance to get them dropped off for you is a great way to do things. That's some of how in Ballston you can help stay safe. Stay inside when you can. Wash your hands when you've gone outside and when you come back in, and that's gonna help work. And then on the groceries question, we have been working with our grocery stores, so you could feel free to email us if you have questions at our county board email address, just countyboard@arlingtonva.us. So we have been working to make sure that folks are that those who work in grocery stores are staying safe and wearing face masks. I'll kind of stop there and see if on the personal protective equipment or the instances of fraud, you want to add anything, Chief?
Well, let me start off with the fraud question because that does come up. We have, so far, we have not really experienced a real degree of any kind of fraudulent activity specifically in the county. But having said that, it is becoming more and more rampant. There is always somebody out there who's going to take advantage of somebody in times like this. So the things that, and the majority of what we're seeing is really on the internet. It's not like we have people going door to door and perpetrating these types of activities. What we do see, though, is people are getting solicitations, whether it's for donations or it's for equipment or it's for gear, but oftentimes there is some level of fraudulent activity related to that, and they are going to look at the most vulnerable. They're probably going to target people that are elder or people that are in need. And so what we always caution anybody, anytime you look at any of the emails, if it's too true to be true, it's probably not. What we encourage all the time, and this is and you hear this here as well, if you don't recognize the email, you don't recognize it, delete it. If it's a legitimate thing, somebody will get back in touch with you and they'll follow up on it. They're calling you and they ask for account numbers or they ask for information to verify so they can provide services to you. Never give accounts, never give personal data that somebody solicited. I would encourage, if you think it's a real serious incident that's taking place, to call us. We'll still come out and take the report. If you don't want the police to show up because you're a little bit concerned about that face-to-face contact, remember, we do have a very robust online capability, and we also have what's called true reporting. So you can actually call in and somebody will take the report over the phone. So there's multiple different ways for you to bring that to our attention. On the PPE question, what exactly were they asking, Mr. DeFerrante?
Sure, thank you. The question is actually concerned for you and your colleagues in the safety. Our police is ACPD. Do you have access to personal protective equipment?
Yes, we do. And we were, the county had enough foresight, thankfully, that they ordered quite a bit of personal protective gear that we had available to us. So we have not been in a position where we do not have it. We monitor it very closely. We do burn rates every day, so we know where we are on those things. But all of our staff have the necessary equipment available to them. One of the things that we'll be adding probably next week is we finally were able to get cloth masks, which are so we're not burning through the N95s, and we anticipate those will be available to everybody as of the beginning of next week as well.
Great. Katie, do you have questions from Facebook?
I do. I'm going to batch a few questions that we're getting about the issue of testing, really important. And so, Jim Schwartz, these might be questions to pose to you. I'm going to batch a couple. The biggest ones are the questions about the supply. What is the supply of the test kits? And then questions also coming in about where can people get tested in Arlington, which our team may be able to post a link to that on the chat box as well. What are the criteria for being tested? And then a couple questions about testing regarding community members who might be more vulnerable. Testing, can you get tested and how if you don't have a primary care doctor, if you don't have insurance? And what about those without transportation options? A lot of our testing sites have been drive up. What about walk up? So Jim, if I might put you on the spot to talk a little bit about how we're thinking about the issue of testing in the county, where, when, how, by what measures and by what means?
Sure, Ms. Crystal, thank you. So testing has actually improved quite a bit, although we are still looking for further improvements. Today, we have 2 sites in the county, one that is operated by the Virginia Hospital Center that is at the Quincy Street complex across the street from W&L High School, and that is, as you noted, a drive-through testing site. There is also a site that's operated by Inova Hospitals that's at 4600 Lee Highway. That too is a drive-through site. We are currently planning to open a walk-through site. It should be open certainly by May 11th. We have a particular site in mind on the south side of the county, but we're still working to cement that location. That will be a walk-up site. People can certainly drive there if they have if they are to be tested, but they will walk onto the site to actually have a sample collected. Right now, all of the samples that are being taken under a doctor's orders. So somebody needs to have their doctor provide them with an order, which has typically been done over the phone or via email. They present that order at the testing site after getting an appointment for a time slot. At present, the only people being tested are those that are symptomatic, those that are actually showing potential signs of the virus. Now, we know that one of the real difficulties in this particular virus is that people who are asymptomatic may also be contagious. But at present, we don't have enough testing capacity to test those people. Look for that to improve here in the weeks to come. What's clear, as you mentioned, in the governor's framework for reopening, is that testing, a lot rests on testing. And the governor has appointed a task force to look at the challenge of testing. That will inform our efforts at the local level. And we will see, I'm sure, improvements in the amount of testing that we'll be able to do. One more area that I would just touch on, because I think this goes to people's concerns about, the importance of our healthcare facility, the Virginia Hospital Center. Everybody that goes into the hospital center for treatment is tested, so that we ensure that that remains a safe space to the best possible degree, and that COVID is not actually in the hospital itself.
Really important information, I think. One just remaining piece about that, you mentioned the importance of getting a prescription for a test from your doctor or primary care provider. What about those who don't have a doctor or don't have insurance?
Yeah, thanks for that. I know that you mentioned that in the beginning, and I missed that. We have actually partnered with the Free Clinic. They will be assisting with us in the walk-in site that I mentioned earlier, and they are still in a position to see people who may be uninsured or don't have access to a primary care physician. So that's one resource. There may be others around the area. The urgent care facilities that operate throughout the county may also be sites that people can go to be seen and get a script from a doctor.
That's great. Thank you so much. One note, I think a question I'm going to try to take on myself before passing the mic back to Matt to ask questions coming in over the chat line. Speaking of testing and the data that can yield about the prevalence of COVID-19 cases or hospitalizations or unfortunately even deaths in our community, a great question from Simone about whether we're tracking that data by race and geography, because that's really important for our work on health disparities in Arlington. So that data on race is collected by the state, the Virginia Department of Health, and you can see the data there. That's the data that we use as well, comes from VDH. People who get treated within Arlington's borders may not be Arlingtonians and vice versa. So that state level data look is important rather than trying to do it ourselves. But I think the thing I would note that is really important for us to wrestle with in our community is that data is not great. By far, the biggest racial category is unknown or did not report. And so we are cognizant of the racial disparities that are playing out in who is getting infected and certainly who's experiencing the most severe symptoms. And we have every reason to believe, in fact, to know that that's happening here in Arlington County too. Our Destination 2027 public health review that was completed last year really emphasized huge disparities, not only in health outcomes by geography, by race, and by income in Arlington, but in disparities around what we call social determinants of health, access to healthy food, stable housing, and so forth. So what we know from the national data is telling us, what we know from our own review of public health and social determinants of health in Arlington is absolutely telling us that those racial disparities exist in Arlington. And we're trying to address our plans accordingly. That walk-up testing site that Jim was just describing is driven by the recognition that people who might be at greatest vulnerability sometimes are those who are least likely to be able to have a vehicle to participate in a drive-through testing site. The partnership with the free clinic is another good example. We're going to continue to push forward on the assumption that these disparities are existing in Arlington, and we're going to do our best to make sure that our response addresses them. So with that, Matt, let me turn it back over to you. Lots more questions coming in over the chat line.
Sure. I think that answer, we got a couple other questions similar. One was on whether results are reported by zip code, and the purpose for that, I think, is to make sure that we're addressing inequities, and we're really focusing on that. So we are using the Virginia state data on that as well. So that's just a data piece. Just a couple of quick items before I check in with Chief Podlitz regarding personal protective equipment. Similar question to Chief Farr. And there are two just quick questions regarding taxes, and whether there's changes in property taxes. And then another question regarding whether home cleaning services are essential. With respect to taxes, the procedures the procedures are staying the same regarding when your property taxes are due, but we are ready to work with. We have a system for working with those who need extended periods with which to pay in light of this crisis. There's a system for pre-agreement where you could pay a small amount in addition, but then extend the time with which you can pay those taxes over the course of the full year. So that's one where we suggest you reach out really to our treasurer, Carla De La Pava, on that one. On home cleaning services, whether they're essential or not, I live in a multi-unit building, and so the cleaning that's in the building, the common areas, is continuing, and that is an essential feature. With respect to your individual home, if you live in a single-family home or a townhome, I think that's really a judgment decision. In many cases, we want to limit the spread, and so we want to limit those interactions that we have with people. So I would lean towards advising you not to continue that. But if you need that cleaning service for your health, then there may be reasons why you should do that. So it's just really a matter of being very safe about it if you do it with respect to those services. So now I want to check with Chief Podlitz regarding same question for you. How or do you have personal protective equipment for all the members of the fire department? And are you taking steps to keep everybody safe there?
I want to echo what Chief Forrest said. Through advanced planning within Arlington County and also within the region, there was a lot of foresight to start to accumulate personal protective equipment for large possible medical incidents. No one thought we would see this large global pandemic here and now. So for those, the equipment that was acquired over many, many years helped us during the month of March and through April. We've been diligent in our trying to acquire that specialized personal protective equipment for all essential employees, for all public safety providers. Now, one of the most important things the public can do to help us is please keep distance, but also please use masks and facial coverings. Regardless if you feel like you're in great health, regardless of whether someone either had the disease and recovered, please wear masks. That goes a very long way to contain the spread of the disease. We just want to make sure we practice what we preach, because we live in the stations for 24 hours. When we are not distancing from each other 10 feet, we are wearing the mask when we're preparing meals. We are wearing masks when we walk through the hallways. We are wearing masks when we are not responding to calls, training, or educating. We are doing that ourselves. So this is going to have to be a new habit we all practice. So if I wear a mask, you wear a mask, and everyone wears a mask, that's going to go such a long way to just protecting everyone.
Great, thank you, Chief. So we have tons more questions, but Katie, do you want to jump in with any that have come your way?
Absolutely. So definitely lots more follow-up questions about testing happening, and I think some of which have already been covered in terms of testing for non-symptomatic people and testing at our hospital. So some folks may want to rewind a little bit when the session wraps up to see some of that covered, and definitely some great suggestions about other places we want to see walk-up testing sites in the county. And as we continue to expand, and certainly as access to testing expands, I think those are ones we can take under advisement. One of the early questions that I wanted to go back to is a good one about contact tracing. Michelle Sullivan in particular noted that the Bloomberg Philanthropies was working with Johns Hopkins on a playbook for contact tracing. But here's another one I think maybe to put to you, Jim, to talk a little bit about contact tracing in Arlington, how we're preparing or have been executing that, preparing to continue to execute that, since that'll be such a key criterion for being able to slow the spread if and when we are eventually able to gradually reopen.
Yeah, thank you, Katie. So, I would just start out the answer to this question by observing that our public health staff has been working on the problem of COVID since the beginning of January. For most of us, this is at this point a 6 to 8 week set of challenges. But Dr. Ruben Varghese and his staff have been at this literally since the beginning of the year. He has been relying on both his staff and what's called the Medical Reserve Corps, which are people in the community that have medical backgrounds and volunteer their time to augment the professional staff in the public health service. And currently we have, or again, Dr. Varghese has 170 people that are engaged in contact tracing. So this is when we get a case, public health is following up with that case. Contact tracing does not mean, one contact with somebody who is judged to be positive, but they're typically multiple contacts to ensure that they are appropriate quarantining or isolating, depending on what the case is, that their needs are met as they are following that public health direction, and that they are monitoring the health conditions of those folks. So we have really extraordinary resources dedicated to contact tracing. The county manager has already indicated that he will increase the staff to support the public health staff as necessary. But right now, Dr. Varghese feels for Arlington, we're in a good place for all of our efforts.
Great, thank you so much. Matt, I'll hand it back to you.
Sure. So a couple of questions regarding nursing homes. And I wanted Jim, I think you may have additional pieces to add to this. I will say one is regarding how nursing homes are being disclosed in LA County and in DC, and the locations of nursing homes, whether they can be disclosed. And as I understand it, Jim certainly add, this really is an area where the governor has taken some steps, and the governor's authority is controlling at the moment. I do feel we've had a number of conversations with Dr. Varghese to really, and he is touching base, as I understand it, on a daily basis with a number of facilities to keep people safe and to minimize infections. But Jim, do you want to add on nursing home disclosure and those questions?
Yeah, Matt, I think you hit on the key points, but the fundamental point that I think people should be aware of is that although we have a local public health department, it is still what you could effectively call an instrument of the state. And it is the Virginia Department of Health that guides all of our decisions regarding, in this case, how information is reported. I believe the governor may be making an announcement today about some changes to some of that reporting. So we'll look to see if he hasn't already. I think it's scheduled for later on this afternoon. We may see some slight changes in that. However, the current practice is not to report data below the county level, and not at the level, certainly not at the level of an institution like a nursing home or a long-term care facility. Other states may have different policies and practices, but that's what the Commonwealth does here. I would echo what you just said about what our public health does in practice, however, and that is that they are visiting each of the long-term healthcare facilities every single day. We have provided them with PPE so that they can take adequate protective measures as they care for the residents there. And we are, as I said, in constant contact to ensure that they're meeting all of the appropriate requirements and doing the best that they can to keep the infection out of their facilities.
Great, thank you, Jim. We are mindful of how hard this is for so many households. We also are trying to think, based on the expertise of Dr. Varghese and our health, our doctors, really. It's a difficult situation for folks to deal with. We have to provide healthcare for individuals in those facilities that may have been pre-existing healthcare challenges that they face. So we're working to solve problems as best as we possibly can. I don't know, Katie, if you want to add anything on that, or wanted to start with another question.
No, that is an incredibly important one out of concern for those residents right now. So I'm glad you all spent a little time on it. I think one question that would be great to get our police chief to weigh in on that has been recurring throughout these Facebook town halls is the question about couldn't Arlington open some of our major streets, especially in the more densely populated areas, or up to walkers and cyclists by closing them off to vehicular traffic. One of the challenges with that has been the issue of enforcing that and keeping all of those users safe. So I wonder, Chief R, if you could talk to a little bit about any considerations there from your perspective of traffic safety and traffic enforcement.
Sure. I mean, I understand that there are some in the community that are very interested in opening up segments and making the roads available. I think it's easy to see sometimes when we do special events, when we close a road for a very short duration of time and a very short specific time period, and we have tremendous amount of resource and assets out there to keep the road safe, that it looks like closing the road is really not going to be that complex a thing. However, I just wanted to remind everybody that when we start to look at any road closure, there's a number of factors that go into it. And it's not simply a matter of the lane size or the width size, but it also includes, do I have parking on that roadway? What are the expectations for parking? Right now, we have other challenges that we have many businesses that are dependent upon the conversion of some of our parking to pick up and drop off spots. Most of the places that I've seen identified also include a number of avenues in and out of apartment buildings or in and out of somebody's home. And so when you start to take a look at, okay, we're thinking about closing a piece of roadway, who is going to be impacted by this? It starts to expand well beyond just the time period. Many of the areas down in Crystal City or Southside are also very much dependent on mass transit capabilities and keeping those roadways open and flexible. So we look at all those factors that come into play. And even if you get to the point where they say, okay, we're going to open a roadway or close a roadway, then you have to have the resources to do that. That's literally thousands of traffic cones. That's literally having some level of monitoring staff to keep an eye on it. And so each one of them poses their own individual problem. So I wouldn't suggest that it's always just an absolute no, but anything that's going to be looked at, all the other factors that come into play have to be considered into that. And I think right now, for us, it'd be a bit challenging to take on that responsibility from a law enforcement perspective. But I can tell you, I know for a fact we do not have the resources, barricades, cones, etc., to cover most of the areas that have been discussed. It just really requires thousands of these things to make it safe for individuals. So I know it's something that's being considered, but I know it's something that would have to be looked at pretty much in depth for each area that they want to consider, and then maybe sort of walk through it from that perspective.
Thank you, Chief R. I think that's a helpful answer to a really common question. Matt, I'll turn it back to you.
Sure. So we've got two areas of questions. One is with respect to masks, and I'll give a start to it and then ask to see if Jim might add. And then another 2 or 3 questions regarding the rate of increase in numbers of cases we're seeing and what might be involved in reopening. First, on masks, we had a question from Arlington and another question about where can we get masks. So that's a good question. Masks, there's not a 100% requirement on masks. We strongly encourage it. We're going to have to work together and encourage people to be safe. There's some, you want to just make sure you are social distancing whenever you are outside, and we recommend the masks in addition. Regarding obtaining masks, that's something we're working on, but having enough for everyone is a bit of a challenge. If you have a question, we have a hotline set up, but I don't know, Jim, if you want to provide any more background on our work on masks.
Matt, the only thing I would add is that actually this afternoon, the manager has a meeting to discuss how the county takes on the role of providing masks. It's sort of seeing how we can coalesce all of the organic efforts that are building up in the community and make sure that those who don't have access to masks can get access to them. I know the supply chain for the masks that are formally referred to as PPE is challenging enough. But if people look around, there are an awful lot of their neighbors that are making masks, maybe even their family members that are making them. So there's a lot of things going on out there, and we're going to try and coalesce those efforts into something that can provide masks to those that just are having really difficulty finding them.
Yeah, I'm glad you described that. It just triggered in my mind. Our board chair, on our website, on the COVID-19 Arlington website, our board chair, Libby Garvey, shows you how to just make a very simple mask, which is one way to address things, but it's also great to hear of the ongoing work we're trying to do to make sure that folks have masks. For questions that we don't get to here, there's both our website, Arlington's COVID-19 website, as well as we have our hotline number, which is 703-228-7999, which is another way you can try and get your questions answered. I'll just touch briefly on the second bucket of questions, which is reopening and the rate of increase and the numbers of increases in cases that we're seeing. We are still seeing increased numbers, but the rate at which that increase is occurring has slowed down. And that's how we know that social distancing is working, at least in part, in Arlington. Doesn't mean that we're done and we have much more work to do. We need to be really vigilant about social distancing, staying home, washing our hands, those key steps. But you do see an increase in numbers, but the rate is slowing down. So some of our efforts we know are paying off. On the other end of the spectrum, there was a question about reopening. And Katie touched in the beginning on the standards that the governor has set forth for reopening. And we really feel that at the current time, we're not seeing that 14-day decline in the percentage of positive tests. We're not seeing enough of an increase in tests and a low enough rate that we can really contact trace for everything. We're not at that step yet. That doesn't mean we won't keep evaluating, but we're not there yet. So that's a couple of answers. Katie, I don't know if you wanted to pick up with next questions.
Sure, I'd be happy to. I'm going to take prerogative and actually ask one that came in over the text line, throwing a curveball into our system, just because I think it's a great one for Candace and Lissa, who are with us, which is concern about whether that information and resources for domestic violence victims in particular, but this may also be true for our child abuse and neglect concerns. How do we know those resources are reaching the people who need them? And could you talk a little bit about some of your efforts to publicize these resources, as well as any work any partner agencies are doing to proactively reach out to families they know might be at risk?
Yeah, thank you. I'm happy to answer that question. And Lissa, please join me in answering as well if you have anything to add. We have been working really hard to try to get the word out about the Doorways services specifically, because they house the majority of services for victims here in the community. They have the 24-hour hotline, they have Safe House Shelter, they support people through the forensic assessment consultation team. They also provide counseling services, crisis management, and referrals for anyone who's impacted by violence, or domestic and sexual violence specifically. So we have been pushing out that information through social media. We've put together a few different types of flyers. We put together a web banner that anyone can use and download and put on their website. If you go to our website, you'll see the banner and can use it. So we've been trying to push out as much information online as we can. However, we know that's not the only place that people are getting information today. And there are some harder communities to reach through online outreach. And so we're also working with our partners at Child Protective Services and other agencies to put together some flyers and some handouts that we can distribute to the food distribution sites. So making sure that we're getting to the families who are picking up grab and go meals at APS or picking up food at AFAC. So really utilizing our community partners to make sure the word is out there about services, so that not only are they encouraging people to seek services if they need them, but also people then have that information at home to use. We also know that it might not be safe for people to call the hotline during this time. And so we've been encouraging people to look at some other resources outside of our community, such as the National Sexual Assault Hotline and the National Domestic Violence Hotline, because they offer chat services. So if you can't pick up the phone because it's not safe, but you can get services on your phone, you can go to those chat lines and they can provide you some support and resources as well, and also connect you back to local resources in a safe way. So those are some of the things that we're doing to get the word out there. But we really rely on you, our community members, to know this information, to know the warning signs and red flags of domestic violence, so that you can recognize if you need to give the phone number to a friend or family member or use it yourself. I do want to add that I think a lot of people have concerns about accessing services right now. The idea of leaving a safe home, leaving a home during the virus. What does congregate living look like? Are services going to be safe? Just like every other public service agency, domestic and sexual violence services are taking exceptional precautions to make sure that we are maintaining the health and safety of everybody who's looking for those types of supports.
And I just wanted to add, thank you, Candace. This is a really timely question because we've been having these exact conversations, the schools and Candace and our Doorways partners, about making sure that the community knows that we're here and what our resources are. So Child and Family Services and the Department of Human Services has a specific link on our website that is about COVID resources. So in addition to what's generally there, you can go to a particular spot that will talk about the extra resources that are available for community and for residents in this time of stress. We're also, as Candace mentioned, we're creating a flyer that's going to go out with lunches, but we're creating sort of a companion flyer about resources for teachers and for who are, in contact with their students, so that they can remember the kinds of things that they can be looking for and what they can be referring the families to. So that's an extra as well. And then I just want to remind, had I said previously, that we have parenting education classes online for parents who need that support. Can go to the website and they can see where those resources are. So we're definitely worrying it. It's on our mind to know that families know that we're still here and that we have their resources to help, and that they should continue to call and ask for support, or if they see something that they're concerned about, or they hear something, because we do get reports that neighbors are hearing noises in apartments or in houses that they're worried about, and they should absolutely call us if that happens, and we will help talk through what a response could be for them.
Ms. Crystal,
Thank you.
if I could just
Please
add
do, yeah.
Yeah, so all the resources that they've been talking about, the police department is very well integrated with our partners in Project Peace and with Child Protective Services. The important thing I would stress is we're out there all the time. We encounter people all the time. We are certainly in a position to put people in the right direction for resources and assist them in any way possible. And the officers receive extensive training on this, not just for the calls we go on domestic violence calls or the calls that come out, but when we get involved in any activity, if anybody wants to come up and ask an officer, this is what I've heard or this is what I'm seeing, they're always available to assist. So we do a lot on our own outward facing public pages and our Facebook page and Twitter, and we're constantly trying to push that information out. But while we may be the police in the front end of this thing, we're really a tremendous asset for this as well.
Thank you. That's absolutely right. Your partnership has been integral to the coalition in non-socially distanced times and is more important than ever. Matt, do we maybe have one final question coming in over the text line?
Sure. So I'll just touch on a couple of questions that came in regarding our employees who have really risen to this moment, all of them. And first, a question about where folks might be able to volunteer if they're an employee. Really, Arlington Cares is a great resource in addition to the great work that you do for Arlington as a community. There's a question about some additional questions about reopening and whether Parks and Recreation would reopen and whether employees, whether there would be testing for employees before they, if they're working remotely, if they come back to a central location, if there would be testing. The answers to that is those are questions that we have been working on, and really it's the county manager and Jim Schwartz. We're not quite at that stage yet. And Jim, if you have anything to add, let me know. We'll add one last thing. We just passed the budget yesterday, and there's some questions about the need for investments in our employees and for compensation. And then there's also other investments that the entire board and the county manager, we all wanted to make. We have really had to recalibrate and we're focusing our resources on making sure that we don't have to furlough or let go any employees. That's a strong goal of ours. But there's a whole set of budget investments we would have loved to do, but because of this COVID challenge, we've struggled to. So Jim, I don't know if there's anything on the employee or the testing on that part of the questions that you wanted to touch base on.
Just I would add, Matt, that so we have begun the internal discussions about reopening government. I would at the outset caution people that that is not going to happen until at least the end of May. We will be in this for a number of more weeks, and then we'll have to decide how to open safely because the virus will still be with us, even though we may have seen a decline in numbers, even though we may all be out of our homes and outside where typically these kinds of things see less in terms of transmission rates. But we still want to ensure that the interactions that we have with the people that we serve, the public, are safe, and that our workspaces for the employees that have to provide those services are also safe. So we have begun those conversations. We haven't gotten very far in them. We will still be guided, as Katie said at the outset of this discussion, by the governor's sort of metrics. But then there are just the practical operational aspects of how we turn things back on. With regard to the question of the parks, that obviously is a high priority for us because we know how much outdoor activities and exercise, recreation are important to people having, to be able to thrive in their lives. So we have a particular focus on that. I would just caution that, again, it's going to be several more weeks before we're there. And even then, we're still going to have to be practicing the social distancing and wearing face coverings. So with that, I'll leave it there for now.
Great. So thank you very much, Jim. That really helps, sort of updates folks on right where we are as a leadership. So Katie, didn't want to leave this 1 o'clock hour without seeing if you have closing thoughts that you wanted to sum up with.
Great. Thanks so much, Matt. Just again, want to thank everyone who's participating with us via chat, via Facebook Live. We are going to keep doing these. So if your question wasn't answered or your questions evolve over the next week, our colleagues will be back, Christian Dorsey and Libby Garvey, to answer your questions. And Matt and I will be back 2 weeks after that. I just want to give a particular thank you to our special guests today. Jim Schwartz from the County Manager's Office, thank you for helping represent some of those remaining public health questions. Chief Pavlitz, thank you. I think a lot of those questions about making sure your teams are staying safe are really indicative of the fact that our community cares a lot about those who care about and are serving us in police and fire and EMS. And we're really grateful to you, to your leadership, and to your teams who are out there every day. Melissa and Candace, thank you too for your work and your teams. Really, we talk a lot about those who are vulnerable in many forms, but when it comes to kids and individuals in situations of domestic violence or child abuse, those really are some of the folks who are absolutely most vulnerable in our community. We're so grateful to your work, and I hope community members have learned something from your comments today about the role they can play in helping neighbors who might be in danger to get help. So with that, Matt, I'll turn it back to you for the official wrap up.
Sure. So you covered a couple of things. I was going to emphasize 2 last thoughts, really. One, want everyone to know that we're all fighting against COVID-19, and it is essential to remember that we're in this together, and that with patience, compassion, and understanding, we will get through this, minimizing infections and helping to save lives. Also want to just make one more point for resources. If you didn't get your question answered or you have additional ones, please visit our website at arlingtonva.us/COVID-19 or our hotline, which is 703-228-7999 for questions on what to do if you feel sick, additional information on testing, access to food and housing assistance, or other questions you might have about the virus. Please stay home, and if you do go out, practice safe social distancing, wear your face covering, and wash your hands often. Stay well and stay safe, everyone. Thanks.